My name is Bob Guterma. I'm the Chief Operating Officer of SupChina. We're a New York-based, China-focused media company. We do independent journalism. We also have conferences, live events. And over the course of our 4 years of existence, we've ended up as a connection point, a bridge between China and the U.S. That's partially at play here. A lot of our donations for the drive that we're having, that we're here to talk about, come from within the U.S., but a lot also come from overseas, from China. And most of the masks we're bringing and other protective equipment, we also have some full body suits that are coming in next week, are coming from China. We're also getting direct donations of materials, not just money, from China. Anyway, there's a relationship there that we're exploring. I want to talk to you guys about it, so I'm going to have you introduce yourselves first.
So my name is Jess Ting, and I am a surgeon at Mount Sinai Hospital.
Great.
Hi, I'm Nancy Paljevic-Murphy, and I am a donation coordinator at Beth Israel Medical Center, the Mount Sinai Hospital as well.
Great. Now, you guys both work in the hospital, and I'm the only one wearing a mask. And I don't know if I feel silly or if you feel silly. And Doctor, you said a minute ago that I should probably be wearing it.
Yes, do as I say and not as I do. Everyone wear your masks.
Got it. And that's good to know, because there's obviously been a large controversy over the past weeks and months. It started off as why are the Asians wearing masks? And now it's the Asians are hoarding the masks. There's this mentality that's shifted here. And it sounds like you said a minute ago before we started that the understanding of COVID is changing. What can you share with us about that?
Well, nothing is definitive, but at this point there are some data that suggests that COVID is aerosolized and can remain in air. And in a situation like that, better safe than sorry, better to be wearing a mask.
Got it. Great. Donations. How important are donations to the function of the system right now?
They're very important. I mean, we're going through all the supplies is disposable, so therefore everything is extremely important. We're all the hospitals together are grouping together, helping each other as much as we can, supporting each other, and any donations we can get, we are accepting.
If one hospital is running low and another has surplus, is there a way for that equilibrium to balance?
If I have to take a cab, I'll take a cab and get it there. That's what we're doing, whatever we got to do to help each other out.
Got it. So there is some city or county level coordination?
Well, I honestly can't say for that. I can just tell you within the hospitals that I've dealt with, there is a lot of coordination between us all.
Got it. That's great. We've heard of certain shipments being blocked because of unknown origin of the materials. Is there some process by which these donations are vetted before they get to the front lines?
We test everything. Everything has to be tested accordingly to make sure that it is legally usable and so forth. Nothing is distributed without testing first and making sure.
So you check the brand, you check it against the
quality, check everything. We totally do quality improvement on everything.
Got it. We have started to hear that the Midwest even is running short. Is there any outreach or program by which all the different, states or regions of the country can work together on this?
Unfortunately, can't answer that question. I don't know at my level. I don't know, because right now New York is the hot spot, and we just need everything we can to take care of the patients that we have. And like Dr. Tang said, they're coming in every day. The numbers are getting bigger and bigger.
There's been a request by Governor Cuomo for nurses to come from wherever there is surplus labor to New York. Has that started to happen? Is it dire?
I wouldn't say it's dire, but definitely it's an all hands on board type of situation, especially when the peak hits. And, doctors are getting sick, nurses are getting sick. If they come down with a cold, they're out for a few days. So.
Has there been any official numbers from the state regarding when the peak might hit for New York?
Again, that's changing every day. I see a different projection. The last projection I heard is they're expecting a peak in 2 to 3 weeks.
2 to 3 weeks. As this has progressed, you mentioned our understanding of COVID is changing. Do you guys get daily updates on best practices and standard of care?
Yes, we get more than daily updates from the CDC, from our own hospital administration.
And how much has the standard of care for COVID evolved from the beginning till now? Is it incremental, or have there been any big shifts in how it's treated?
I mean, it's so new that there is no standard of care anywhere in the world. So it's impossible to answer that.
Got it. Doctor, outside, spring is breaking, And despite the lockdown, a lot of us haven't been directly impacted by this. And it seems surreal outside of the health system, at least, or outside of anyone who's had a family member affected. How does it feel inside the hospitals?
Well, it's scary. I mean, it's hard to imagine, right? Beautiful spring day, it's warm out, but it's another world, and it's real, and it's here, and it's going to get worse.
On the reality of the pandemic, but also just the preparation for the equipment, we saw what was happening in China starting back in December or January. And many people have faulted the system or the government for not taking action sooner. At the same time, it's also been talked about how this just literally has never happened in modern history, not in the past 100 years. And humans learn by trial and error. We haven't had this trial or error in a long time. Was there a sense or a conversation in the health system that this would happen, or has it really caught us all by storm?
I mean, I think that there were lots of discussions about what was coming, but I don't think anyone really can prepare for this until you experience it yourself firsthand. It's one thing if it's happening halfway across the world, it's another if it's in your backyard. And until it actually came here, I don't think any of us really understood what was coming. And we really haven't seen the worst of it yet.
So, regarding the worst of it, is there a sense that we are approaching capacity in the system, or has the surplus capacity brought by the U.S. Navy ship, Javits Center, the field camp behind us here, that it may buy us enough time as the curve hopefully flattens?
I mean, I can't speak to the exact numbers, and they're literally changing by the hour, by the day, as new beds come online and as capacity increases. But at the same time, we're getting more and more patients. So it's just a very dynamic situation.
Inside the hospitals, amongst the nurses and the doctors, what's the mood? What's the feeling? Do people feel united in their cause? Do they feel worn down?
I can honestly tell you, in my part in Mount Sinai, Beth Israel, everybody is united. We're tired, but we're doing it. We're helping each other. We're supporting each other. Whatever we need to do, we're doing it as a group. We're doing it as a team. We're doing it with our sister, brother hospitals and everybody else together.
Yeah, exactly. Everyone's pitching in.
Awesome.
And they've been very helpful and very supportive, from Chinatown, from Flushing, you name it, different parts of the city, everybody, different parts of the world. Yeah. It's been the world has come together is what has happened.
I can speak to that. I mean, I get messages daily on Facebook Messenger from China, Hong Kong, Japan, people I've never met before who are offering donations. So it's really an incredible response from all over the world.
Actually, now that we've gotten on this wave, Dr. Ting, what is your background with China? Are you ethnically Chinese but born in America, or were you born in China?
I was born in Asia, and my family and I immigrated here when I was very, very young. So. Got
it. And do you mind if I ask you at least your opinion on some of the anti-Asian racism that's grown?
Sure.
All right. You don't have to say too much, okay. But yeah. There have been reports of over 650 attacks on people of Asian ethnicity for some perceived culpability for COVID-19. Have you personally seen that or heard of it in your group of friends? Or have you personally experienced that? What do you feel about it all?
It's real. I have friends who have been cursed at, had nasty things said to them. I go to the supermarket and I get all kinds of looks, and it's not a nice feeling.
It's remarkable to me that that's still possible in this country and in this time of emergency, but it's real.
I mean, ultimately, when this is all said and done, and I know we're going to get through this, I think this can be a moment where it's a turning point, where we understand we're one community. China, the US, Europe, we're all one people. We all get afflicted by the same diseases. We all face the same challenges, and we're all in it together.
SupChina is a New York-based, China-focused independent news media company, and we have partnered with the Committee of 100, a U.S.-based philanthropic organization dedicated to promoting strong U.S.-China relations, to leverage relationships in both countries to ensure supplies get where they are needed, fast. 2 days ago, we delivered a large shipment of CDC-approved N95 masks to Mount Sinai Hospital in New York and spoke with Dr. Jess Ting and volunteer and donations coordinator Nancy Paljevic-Murphy about the donations, the pandemic in general, and what we can all do to help others.